Hello, my name's Lisa Bembridge and I'm one of the physiotherapists that works within the rheumatology department at Queen's Hospital in Burton. I work alongside my other physiotherapy and occupational therapy colleagues, some of them you may have met, and also the consultants and the nurse specialists, all who have had input into this presentation. Now, I guess you'll be listening to this presentation if you have recently or in the past been diagnosed with fibromyalgia. This diagnosis may have come from one of the consultants at Queen's Hospital, or a consultant at a different hospital, or maybe from your own GP. So we know that the first step to effectively managing fibromyalgia is to gain an understanding of what the condition is and what some of the symptoms are, so that we know what we can do about them. So in this talk, I'm going to talk about what fibromyalgia is, what are some of the most common symptoms that you'll experience with fibromyalgia, what causes some of these symptoms, and then, probably of most importance to you, what can be done to hopefully manage and reduce these symptoms. In physiotherapy, we aim to provide you with the knowledge and confidence of knowing what to expect and what to do when your symptoms are at their worst. So during your journey, you'll experience many different emotions and feelings. Due to the nature of the condition, it can take a long time to diagnose fibromyalgia. So you might have had numerous trips back and forward to the GP or other health professionals, and they might have told you different things, and this might make you quite confused about it all. Understandably, you'll be desperate to get some relief from the pain, so you've likely tried different medications which might have taken the edge off at best. Over time, you're likely to feel frustrated and lack the confidence that anything is going to help, and you might feel quite angry that nothing's helping. You might feel let down that nobody's doing anything or providing anything which helps enough. You might feel quite anxious about what the future might hold. Can you continue with your job? Can you manage your household? And this will likely make you feel alone and isolated. The reason that I talk about these different emotions is because I want to reassure you that they're completely normal and you're not alone when you feel like this. So here in physiotherapy, we want to give you the support and the reassurance that you're doing the right thing. We can provide you with the knowledge about what the condition is and what to expect. We can recommend different exercises and give you other advice on how to manage some of your other symptoms. We like to think that we can give you a sort of toolbox of options that you can dip into as and when needed to help to manage your symptoms. But now, the journey starts with you. So the benefits that you're going to get out of this depends on what you put in. We can give you the advice and the recommendations on how to manage, but you need to put this into practice. You need to get to know your symptoms, get to know what triggers your symptoms and how to manage these, but then also what's best to help and help to manage your symptoms. So let's start with gaining some knowledge about what fibromyalgia is. So fibromyalgia is a long-term condition that causes widespread pain and fatigue, and these are the main symptoms. Fibromyalgia is actually really common in the UK, probably more common than you think, and it's likely that you know someone or of someone who has fibromyalgia. For example, Lady Gaga, who has a diagnosis of fibromyalgia. It's more common in women than in men and is usually between the ages of 30 to 60. We're not exactly sure what causes fibromyalgia, but researchers suggest that there's often a trigger before the symptoms start. So this might be a trauma or a stressful period in your life, such as a bereavement or an illness of someone close to you. It might be following a period of illness in yourself or going through a tough pregnancy or losing your job. On the other hand, it might be that you have another condition which causes pain, such as arthritis or joint hypermobility. And due to the persistent pain of these conditions, that can then become more constant and long-term. So, the most common symptoms in fibromyalgia is the widespread pain that's been there for more than 3 months, and we call this chronic pain. You might feel particular tender or trigger points, or your skin might feel quite sensitive. You might notice sensitivity to other triggers such as bright lights or loud sounds. You'll likely feel extreme fatigue and have sleep disturbance. So this might be difficulty getting to sleep initially, or it might be that you can get to sleep, but then it's difficult to maintain that sleep and you wake throughout the night. And you'll probably wake in the morning feeling quite unrefreshed. You might also hear the term fibrofog, and this describes that fuzzy, muddled sort of feeling, and this can affect your memory and concentration. So other symptoms that you might experience with fibromyalgia are headaches and migraines, dizziness, irritable bowel syndrome, bladder symptoms, and also another common symptom is chest pain. Unfortunately, with these symptoms, there's nothing that we can do to stop them, but we think that by recognising that these symptoms can be related to fibromyalgia, it can be easier to recognise and manage these symptoms. So, for example, you might identify certain foods which trigger your IBS or different triggers for your migraines and try to reduce or manage these triggers. We also understand that these symptoms aren't always related to fibromyalgia. So if you feel that there's been a change in your symptoms or that they're getting worse despite good management, you might want to speak to your GP just so that they can rule anything else out. So how do they know it's fibromyalgia and not something else? There's no specific test that can be done to diagnose fibromyalgia, and they call this a diagnosis of exclusion. So the doctor will listen to the pattern of your symptoms and piece together the history. And this in itself might be enough to diagnose fibromyalgia, as they can rule out any inflammatory or connective tissue conditions, as fibromyalgia has quite a different pattern. They then might do some blood tests, again to strengthen the diagnosis. Again, this will rule out any inflammatory conditions. It might be then that once the consultant has diagnosed you with fibromyalgia, that they discharge you from their clinic, as at this point there's not so much more that they can do for the management, but then they'll refer you to physiotherapy, and then that's where we come in. Let's look in more detail at some of the symptoms of fibromyalgia, and let's start with that widespread pain. So this pain might affect different joints or different muscles. It might be constant, so it might be there all the time, or it might come and go. It might come and go and flit to different areas, or there might be no pattern to this at all, and it might be completely different on different days. This is normal, and let's have a bit more of a look at why this is. So at this point, I'd like to highlight that fibromyalgia is not an autoimmune disorder. So this means that the pain you feel with fibromyalgia is not caused by inflammation or tissue damage. Pain is an important sensation though. It's protective, so your body recognises that when it feels pain, something needs to be done to protect yourself. So let's look at what happens during the normal pain pathway. For example, when you bang your elbow. So first you bang your elbow, and then receptors around your elbow send a message up via the spinal cord to your brain. During this message, certain chemicals are released which helps this message along the way. Once the message then gets to your brain processes this message and it works out things like where the pain is, what's the level of the pain, what's happened, do we need to do anything? Your brain then sends the information back down through the spinal cord, back to the site of injury. Again, during this message, more chemicals are released, which then help to control and modulate the pain. And we can do other things that help to strengthen these messages as well. For example, rub your elbow or use heat or ice. So over time, this protective element of feeling pain is not exactly helpful if we're starting to feel it more often. So for example, if you start to feel neck pain every time you're sitting, your brain will recognise this, and it'll also recognise that if you just alter your posture slightly, the pain feels a bit better. Over time though, it makes this change more permanent. So certain muscles will become stronger and tighter, and other muscles will become weak until you develop this other painful sort of posture. With fibromyalgia, it's like the volume button on the pain pathway has been turned up, and we know that there's a number of reasons for this. So let's look at what happens in the fibromyalgia pain pathway. What you can see from the picture of the telegraph pole is that the signals are muddled and confused, and this is a little bit like what happens in fibromyalgia. There's changes in the nerve signals and they become sensitised. So this means that there's no triggers which start that pain signal, or the triggers that you do feel shouldn't usually be painful. For example, when someone taps you on the shoulder or gives you a hug. Also, your brain's then unable to process these messages, so it can't tell where the pain's coming from, which means it feels more widespread. Then it's unable to regulate and control the pain. So rather than going off, it remains more constant. Your central nervous system is also really good at learning behaviours. So for example, when you learn to ride a bike or drive a car, if you do it more often, it becomes automatic and you don't even have to think about it. And this can happen with pain as well. So if you're feeling pain every time that you do a certain movement, your brain and your central nervous system start to learn this pathway and learn that every time you do this movement, it's going to be painful. This means that with fibromyalgia, you might feel pain with doing even just light movements, such as standing, walking, bending, turning. And this is obviously going to affect day-to-day activities, such as going shopping, going out for a walk, doing household chores, or going to work. Understandably, you might become fearful of doing these movements and even avoid doing them. But this can have a negative impact on your body, because if you avoid doing movements, your muscles will then start to become weaker. And then when you start to do the movements again, it's going to be more painful. Also, if you start to reduce your activity, it might be then that you start to put a bit more weight on. So again, this is going to increase the pressure through your joints and increase the pain. It's important to know, though, that we can turn this volume button down on the pain pathway, and there's a number of ways that we can do this. Later on in the talk, we're going to look at some of those management techniques on how we can help to reduce the pain. So another common symptom in fibromyalgia is this extreme fatigue. So this is more than the tiredness that we all might feel day to day, that we know is going to pass if we can just get through the morning or through that first hour in the afternoon. This might feel that you could literally fall asleep during meetings or your favourite TV show, or that once you've climbed the stairs you physically need to stop and rest. There can be a number of different causes which makes this fatigue worse, and it can also then become a vicious cycle. It might be that the pain that you feel with fibromyalgia is disturbing your sleep. So it might be that it's difficult to get comfortable to get to sleep initially, or it might be that you can get to sleep, but then once you start to move or turn over in bed, that the pain wakes you throughout the night. We know that stress and anxiety can make your fatigue worse as well, and also it can increase your pain and it can disturb your sleep. All of these factors are going to contribute to your fatigue as well. As we mentioned before, if you start to avoid doing movements, your muscles become weaker. You need more energy to be able to do these day-to-day tasks. So again, this is going to make your fatigue worse. Also, just trying to manage day-to-day with all these different symptoms can be exhausting in itself. So hopefully this has covered a little bit about what fibromyalgia is and what are some of the symptoms and the causes of these symptoms. And hopefully it's given you a bit more knowledge and confidence in the diagnosis of fibromyalgia. If you have any questions about this, you might want to write them down and bring them to your next appointment, or you could email them to us and we'll do our best to get back to you as soon as we can, and I'll provide the email address later on in the talk. So now let's move on to the management of fibromyalgia and hopefully giving you some advice and strategies to help you to cope and manage the symptoms. So we know that there are many different triggers which can make your symptoms worse. And what you need to do is to try and identify these triggers so that we can help to manage them, and then also identify what helps these symptoms, again, so that we can help to reduce the symptoms of fibromyalgia. It might be helpful to think of this like the stress bucket, as in the diagram. So, as you can see with the stress bucket, we have stressors coming into the top of the bucket and filling the bucket up. And then coming out of the bottom are ways in which we can manage that stress and let it go out of the bucket. If you're managing this quite well, then you'll be around the middle, around that normal line, and you'll be feeling okay. If there are not so many triggers or stresses coming into the bucket, or you're emptying them out really quickly, you might feel really quite relaxed, but we know that this doesn't happen very often. If there's more triggers or more stresses coming into the top of the bucket and you're not able to empty them out, then your bucket will become full, and we know from the first half of the talk that an increase in stress can make your symptoms a lot worse. So what we need to do is focus on what's coming into this bucket and if there's anything we can do to reduce this, and also what's going out of the bucket and if there are any strategies or ways in which we can help this. It's important to say that this stress bucket is going to be different for everyone. We all experience different stresses day to day, so what's going to be coming into the bucket is going to be different for each of you. Also, on the other hand, what's relaxing and restful for one person may be completely different for somebody else. So again, it's important to recognise what you feel helps yourself. We're going to cover now some ways that we can help to manage this stress and different techniques. But what you need to do is to pick out what you feel will be helpful to you and put that into your toolbox so that you can use it as and when needed. So in physiotherapy, we encourage exercise and physical activity and movement. As we know, this is really important. But I also think that rest and relaxation is equally as important. You need to give yourself time to stop and recover. We know that relaxation is proven to lower blood pressure, and it helps to reduce stress and anxiety. It gives your body time to repair and to recover. And if you think that you're one of those people that are on the go all the time, at work or helping friends and family, you need to take the time to stop, otherwise you'll just burn out and then you won't be helpful for anybody. It might be that you practice 10 minutes of relaxation a day. So this might be 10 minutes of mindfulness practice during the day. It might be that you do this in the morning, so it might be the mindfulness or 10 minutes of morning yoga to help you get set up for the day. It might be better for you to do this practice in the evening to help you relax and unwind after the pressures of the day. It might be that you feel stress and anxieties more often throughout the day, and it might be that you start to feel irritable. So it might be better for you to do smaller, more often sort of do these practices throughout the day. So something like box breathing or body scanning might be helpful. Other ways in which you can relax and rest are things like listening to music or relaxing podcasts or playing instruments. It might be doing exercises such as yoga or Pilates or Tai Chi. These are all good exercises because they encourage you to focus in on how your mind and body are feeling. If you're interested in any of these exercises, you could talk to us about these and we can recommend any local classes or if there's any practices which would be suitable for you on YouTube. Now, we also know that pacing is effective in managing fatigue as well as rest. We know that with fibromyalgia, due to the fatigue, you might find it difficult to get everything done all in one day, and you might feel that you need to rest more often. And we understand that this can be frustrating, as you could do it before with no problems. What you'll find is that if you try and get everything done all in one day, it will wipe you out then for the next couple of days, and you'll need to stop and completely rest. Over time, you'll then start to feel a little bit better until eventually you'll have a good day again. And you'll try and take advantage of this good day by trying to get everything done all in one day. But again, this will then wipe you out for the next couple of days, and it continues in this cycle. This is called the boom and bust theory. We know that if you can effectively pace yourself, you'll find things more manageable, and you might be able to do a little bit more day to day, and this will help to manage your fatigue. In helping to manage your fatigue, it might be useful to think of the 4 Ps. So firstly, we have planning. Try and schedule what you're going to do throughout the week, and don't put too much in. Try and schedule resting throughout the week as well, so that you're not doing too much on too many days. Prioritising. Only say yes to the things that you want to do. If, like me, you say yes to everything, try and learn to say no more. Think about, does that need to be done today? Or can it wait until another day when I haven't got so much on? Problem solving. Are there any ways in which you can make these tasks easier for you? For example, if you find shopping a high energy task, maybe you could do some online shopping. Try and make the things that you use more often in more accessible cupboards, or so you might have to move things around a bit so that you're not constantly reaching or bending for things. And pacing. As you're doing the activities day to day, as we said, try and schedule in regular rests and breaks. To help you with pacing, it might be useful to keep a fatigue diary. With this, you identify the activities which are high energy, medium energy, and low energy activities, and you label these red, orange, and green. You can then put these onto your fatigue diary, and it's useful so that you can see where in the day or where in the week these tasks are. So what we can see here is a bad example, because you can see that all the red and the orange tasks are all grouped together and there's not so many green. On this example, it's much better pacing, so there's fewer red areas which are spread throughout the week, and these are interspersed then with the green tasks. So as well as rest and pacing, it's also important to get a good sleep. Sleep is important for recovery. While you're asleep, your muscles repair. You make your memories and you consolidate learning, and your hormones strengthen your immune system. So to improve your sleep, if this is one of those things that you struggle with, it would be good to try and practice some good sleep habits. Your body likes routine, so what we would say is try to go to bed at the same time every evening, and then try and set your alarm for the same time in the morning, even at the weekends, so that your body gets used to this routine and it knows this sleep pattern. Try to avoid caffeine before you go to bed, and it's probably most beneficial if you can either avoid caffeine or switch to decaffeinated drinks after midday. Try and make sure that your bedroom is the optimum environment. So this means not too warm, as your body temperature cools throughout the night. Make sure it's not too bright in there, and make sure it's comfortable. Try and do something relaxing before you go to bed. So as I mentioned before, this might be some mindfulness or some gentle yoga or exercise. Nothing that's going to raise your heart rate though. It might be reading or listening to an audio book. Try and reduce any blue light, so any mobile phones or iPads or tablets. If you find that it's difficult for you to switch off before you go to sleep, so if you've got things running through your mind or if you're trying to remember things for the next day, it might be helpful to keep a notebook next to your bed so that you can write things down. So this can be, journaling is a good example of this, and this can be a useful technique to try and reduce stress and anxieties. Or it might be that if you're trying to remember things, you write these in a list on your notebook, and then they'll be there to come back to the next day, and you can clear them from your mind when you're trying to go to sleep. For any more information on sleep habits and trying to improve your sleep quality, the Sleep Foundation website is a really good resource that you could look at. So on the topic of clearing your mind, it might be helpful to talk about how you're feeling. If you're feeling quite stressed or anxious, doing something relaxing or getting a good sleep might be enough to help with this, but it might be that you need more help. In physiotherapy, we're happy to listen and provide reassurance and support, but we're not trained in giving advice or counselling, and this might be what you need. As we mentioned, fibromyalgia often has a trigger which might have been a stressful or traumatic event, and you might need some help in trying to deal with this. Here is some really good resources which can help. And it might be that you need your GP to refer you to these services, or they might allow you to refer yourself. With the NHS website, this gives you services which are closest to you, and also how you go about being referred into these services. If you want to have a look at any of these though, or if you feel like you need any help with this, please talk to us about it and we can provide you support in looking into these services. So now on to my favourite topic, which is exercise. Exercise has so many health benefits, and it's the one thing that's proven in research to help to reduce the symptoms of fibromyalgia. There's not one particular exercise which has been proven to help though, so the most important thing is that it's something which you enjoy doing. Exercise needs to become a regular habit or activity in your schedule or day to day. So it needs to be something that you want to do. If you try and do something that you don't enjoy, it's just going to become a chore, and it's going to be much easier to find other things which are more important to do. You might think that you don't enjoy any type of exercise and that going to the gym, lifting weights or running on treadmills just isn't for you. But exercise doesn't have to be going to the gym. It can be going to the pool and swimming, or even just walking in the pool. It might be going for a gentle walk with family or friends, or cycling, or it might even be having a dance around the kitchen. Here on the Chartered Society of Physiotherapy website, there's loads of ideas and guides on how to get started with different exercises or activity. So the Public Health England and the World Health Organization give recommended guidelines for exercise to do over a week. They recommend at least 150 minutes of moderate intensity activity or 75 minutes of vigorous activity a week, or a mixture of these. We would obviously recommend doing the 150 minutes of moderate intensity activity, and this is anything which raises your heart rate and makes you a bit out of breath, but still able to hold a conversation. And this is called aerobic exercise. They also recommend doing strengthening activities on 2 days of the week, and also trying to reduce the length of time that you're sitting per week. So there are loads of benefits of exercise to both your physical and mental health. We know that exercise can help to reduce over 20 chronic health conditions, and this includes some forms of cancer, heart disease, stroke and diabetes by up to 50%. When you exercise, your body releases a feel-good hormone, so it helps to reduce stress, it boosts your mood and also improves your energy and improves the quality of sleep. We know that this isn't as easy as we make it sound, especially when you get the symptoms of fibromyalgia such as pain and fatigue. So what we'd say is start with something easy and gradually build this up as you're able to. So as I said, with aerobic exercise or activity, this is something which makes you slightly out of breath but still able to hold a conversation. 150 minutes over the week equates to about 30 minutes a day over 5 days. And you might do it like this, or you might break it down differently, whatever's going to suit you. So by starting easy and gradually building this up, let's use walking for an example, but you can apply this theory to any type of activity that you'd like to do. So what you could start by doing is going out and walking for just a couple of minutes to begin with. Then see how you feel after this or the following day. If you feel relatively okay, then stick at this time for, say, the next week. Then, after this week, try to build it up to 5 minutes. And again, monitor how you're feeling and stick to this and gradually build it up. Or it might be that you use different landmarks. So, to begin with, you might walk to the first lamppost, see how you feel, and then the following week walk to the next lamppost and then the next tree, and so on. So it's also recommended to do the 2 days of strengthening exercises per week. We know that over time, with the strengthening exercises, these help to build your muscle strength. So it's going to make day-to-day tasks more manageable because you need that strength in your muscles to stand from the sofa or lift the kettle or carry your shopping. We also need to start to introduce those exercises and movements which you might be fearful of doing and avoiding because of the pain. We need to tell your brain that, and to try and help your brain to relearn these pathways and tell them that they're not painful, so that we can do these in a more controlled way. Things like yoga and Pilates are good strengthening exercises, or things using your own body weight, such as sitting and standing from the chair or squats. You could use weights at home, such as small water bottles or tins of beans, and we can recommend certain functional exercises which will be beneficial for you. We also know that stretching exercises are going to help. As we said at the start of the presentation, because of changes in your posture, certain muscles will have become tight. So by helping to stretch these muscles, we can relieve the tension and help to improve your posture and reduce the pain in these muscles. And again, we can help to advise you on specific stretches which will be beneficial for you. Or again, something like yoga are good stretching exercises. I'd like to highlight at this point the normal response to exercise. So you might feel that when you start to exercise, that initially your pain might get worse. But remember, listen to what your body is saying and remember to pace yourself, but do persevere and it will get easier, so keep going. So that's the end of the presentation. Remember to effectively manage fibromyalgia. Take care of yourself. Take some time out to rest and relax. Try to think about what stresses are coming in and what you can do to help to try and manage these stresses. Think of the 4 Ps to help to pace yourself and try to manage that fatigue. Try to get into your good sleep habits so that you can improve your quality of sleep, which will also help with the pain and fatigue. Remember, there's many different emotions that you'll feel and go through with fibromyalgia, so talk to somebody about how you're feeling, and if you need any more support with this, we can help you. And lastly, exercise. Make sure it's something that you enjoy doing so that you can fit it into your day-to-day routine. Here are some really helpful resources that you could look at your own leisure, which covers everything that we've talked about in the presentation. Hopefully this has given you some more ideas to put into your toolbox, as I say, that you can use as and when needed to effectively manage your symptoms. If you've got any further questions on, as I say, the beginning, the diagnosis or the management of fibromyalgia, or you'd like any further advice, write these down and bring them to your next appointment, or you could email them to us and we'll do our best to get back to you as soon as we can. Thank you for listening.